Horizon Treatment Services, inspiring hope and healing since 1976.
Well, hello, everybody, and welcome again to the Horizon podcast. I'm very excited about our guest today. We have Justin Phillips, and she's going to introduce herself here in a second. We're going to talk about the Shorty Awards. Justin just won an award for this incredible Kate Chatbot that she'll tell you a little bit more about. But we like to talk about the technology being used in the industry. We like to talk to thought leaders and people who are thinking, forward thinking. And so we've got quite a show for you today. Let's start by getting to know Justin. Can you introduce yourself a little and tell us about your company?
I can. Thank you so much, Jen, for having us. I'm Justin Phillips. I'm the CEO and founder of Overdose Lifeline. We're a nonprofit. We're based in Indianapolis, Indiana. We serve the state of Indiana in a variety of direct service ways, but we also have national programs that are used across the country, to include our online learning and Kate, our most recent introduction to helping address barriers for asking questions.
Yeah, so tell us about Kate and tell us about this chatbot that just won the Shorty Awards. I'm really excited about what you all have done here and what you've accomplished, so I'd love to share that with the audience.
Yeah, thank you. So, Kate was really born. Kate stands for Knowledge, Advocacy, Trust, and Education. And she is AI, and she is AI, but she's unique in the fact that we built her answers. So she doesn't answer from ChatGPT. She answers from a repository that is well-sourced and evidence-based so that we avoid hallucinations and all those other challenges that come with traditional AI and ChatGPT. And we built her because we
hallucinations are a big deal.
That's shame and stigma. Yes. And people, the funding that we received to build Kate, that was a big concern. So we definitely had to work on addressing that and test and avoid that from occurring, which is one of the reasons why she can only answer from the repository.
So Justin, excuse me, let me just say for the audience what hallucinations are, because I only learned this term a couple of months ago. Hallucinations, when AI is said to hallucinate, it's sort of where they have a little bit of information, but then they just sort of make up the rest, right? So it's when it's trying to fill the void between two things that it knows for sure, or two facts it was actually able to find and substantiate, and then it sort of like fills in the rest, which is why it's so critical with AI as a tool in general, in any way that you're using it as a writer or as you are, Justin, in this field, being mindful that it's a tool, it's a drafting tool in general terms, and it's one that you'll always have to double, triple check. Now, in your case, you're saying that to avoid hallucinations, it was really important for the funding and also for the support that it provides in such a life-saving manner that you all taught it. So to be sure that it has all of the information that you needed it to have and evidence-based. Who was it that provided the information that trained the bot?
So it's really our subject matter experts that we use within Overdose Lifeline and our outside subject matter experts to ensure that the answers were appropriate. And again, as you said, Jen, she can't pull from the web. She only pulls from what we programmed her to do. And so sometimes she'll say, I can't answer that question, and give you a referral website or a referral phone number.
I love that. So you mentioned that stigma is one of the biggest barriers. I certainly know this to be true. And I think that a lot of people who experience addiction, I am somebody who's in long-term recovery, and I know that a lot of folks on our team are also have lived experience, but our clientele is always experiencing the stigma. So what is it that you think this particular program does to help folks reach through that barrier?
So one of the things that we learned at Overdose Lifeline when we're trying to get the message out, especially in this current drug climate with fentanyl, right? Oof. Fentanyl is in anything, and we have a lot of young people who perceive they're getting a Xanax from their friend when in actuality they're getting fentanyl and the sort of belief that not my kid, I have a good kid, and all those things that we as parents, we can't help but have those feelings, and substance use disorder and drugs are a really complicated problem to address. So nobody wants to admit that they're concerned. Nobody wants to ask the questions. And in much the same way we do our naloxone distribution in ways that can be fully anonymous, we wanted Kate to be a place where you could come and you wouldn't have to feel that shame and stigma, because you wanted to know, is it possible that your loved one is having an experience with substances that you need to address?
So this isn't just for the individual using substances that finds themselves in a panic mode of, uh-oh, this is going south. Where's Kate? Where is it located, and how can folks get to it?
So currently Kate is on our website, which is overdoselifeline.org, and she's right there, and she'll pop right up and chat with you, and she's completely anonymous. So we don't record what you ask. We only record the trends and the answers. So we can't fully even divulge what are the most common things people are asking. We can only divulge what the most common answers are. Sorry.
And what do you find trending in that regard?
Yeah, so lately what's been trending is, what is fentanyl? What is
wow.
naloxone? Where can I get naloxone? Is it legal to have naloxone? And then towards the end of the year, Jen, and you'll understand this as a professional, we had a lot of people trending to ask about CEUs and mate requirements, which is the federal act that required physicians to get education in substance use disorder.
Really interesting. You think about, okay, so stigma is a huge barrier, great, but the basic nature of the questions that you're finding trending, what is it? Mm-hmm. What is naloxone and what is fentanyl? I mean, boy, to be embarrassed to ask that question and not have a place to go for just that basic understanding. You just think about how far people actually are from understanding this stuff.
It's true. It's super surprising for me, because we passed the law in Indiana for access to naloxone without a prescription in 2015. And it's super surprising to me that, a little over 10 years later now, people still don't understand, and they still don't understand how easy it is to get and how simple it is to use, and its role in saving people's lives. It's curious. And I think a lot of it has to do with the stigma around addiction. Honestly, it's just one of those things that'll never happen to me, and it's those people, and we know that to not be true, obviously, with yourself divulging, and I myself have been in recovery a long time. It can be really super intelligent people managing their lives and still have substance use disorder.
Well, thank you for calling us super intelligent people.
Well,
I happen to know quite a few in recovery who are super intelligent as well. But, a lot of the folks who come to us for the treatment are super intelligent and distracted by the absolute horror that is addiction, right? Yeah. So I truly believe in the work that we do in terms of trying to help those folks get back to themselves. Mm-hmm. And occasionally you see wild successes. What is it that gave you what was the impetus of this project?
For Kate, it really was, Overdose Lifeline was born out of my own personal loss of my 20-year-old son, Aaron, in 2013. And 2013 was early, really, an opioid use crisis. And we didn't know naloxone was a thing, or we weren't talking about overdose being a real possibility if someone returns to use and all that stuff. And so we at Overdose Lifeline have continued to try to fill the gaps. And with Kate, it was this, we've got to get people to understand that fentanyl is a real threat, and you can simply test your drugs before you use them and potentially change the way you're going to use your drugs and not overdose, especially those young people. So we wanted to get to the parents, the caregivers who were really unwilling, and that's really how we started with Kate.
And what is your success rate in reaching that adult population? Are you able to tell those things?
Well, we know we've had over 250,000 engagements since we launched Kate, which is going to be a year in March.
Oh,
2026 will
wow.
be a year. Because we don't collect any kind of personal information at all, we don't really know the age or the demographics of individuals that we're reaching. But in this next phase that we're working on for 2026, we're going to change Kate to speak to the youth audience and hopefully find a way to reach them in their own bubble of misinformation.
That's amazing. 250,000 engagements
Yeah.
within just short of a year.
Yes. Mm-hmm.
So I imagine there's been some, and I'm guessing, I imagine there's been some, you know, people concerned about who don't understand, concerned about the fact that it's AI, or could it possibly be providing good information and those types of things. Have you had a lot of pushback, and where has that come from? And also, in spite of that, it sounds like you're having incredible engagement. So anything you can tell us about any of those things, I'd be really interested.
Well, initially when we started the project, we had pushback from our funders because they were concerned about the hallucinations that we discussed
Sure.
earlier.
Sure.
And when people ask me what is Kate, I always try to lead with she's an anonymous source of answers from a repository that we built.
Nice.
Because as soon as you bring in the AI or the chat GPT conversation, people sort of tune you out and don't think it's legit, even though
Right.
it's a useful tool in the appropriate manner, right? And so I think that that's really been the pushback that we've had. Now, you can trip up Kate if you start to ask her the same question over and over. And there are people out there who try to do those things and then communicate to us that they don't appreciate her as a tool. But there's always going to be those people. We're never going to be able to make everybody happy.
But you have found that its utility has been proof positive.
Yeah. And I think it'll be interesting this year when we work with the youth. We're working with some focus groups with youth at some of the local universities and colleges in Indiana, and we're having youth help us build the repository and answer the questions in their language, and all of our promotional materials and marketing will be geared to that age group, because we really do, our youth are in a world of hurt for lots of reasons, right? And we need to help them find a place where they can have conversation without judgment.
Yeah. Thanks for touching on that. I think, at Horizon, we do a lot of work with the youth in high schools, in the area of prevention work in the schools. And we really trying to do what we can to also reach out to the parents. What do they do when they're noticing things with their kids? These are probably some of the same parents who are typing in, what is fentanyl? I mean, there just really is no starting place for some of these folks who are raising our kids and just don't know about this stuff. So trying to be a resource is critical. We just put together a parent-facing youth resource guide for the SUD and mental health questions and challenges, and it has been so profoundly well received in the community. We did it in both English and Spanish. A large population of our community that we serve in the schools and locally is Spanish speaking, especially the parents. So when you talk about advocating for that, I think that's probably almost more important than just having it on the website. I mean, getting these kids the opportunity to ask the questions that they're afraid to ask their parents. So tell me more about that. Tell me more about the prevention aspect that you're moving in that direction, and how far do you see that reaching?
Well, at Overdose Lifeline, we do a lot of prevention already with the youth. It was sort of one of the first things that we did, in addition to access to naloxone. So we have 2 proprietary programs that we've developed to help kids understand opioid use disorder.
Yeah.
And we go in the schools and we provide those. And, I think it's something Aaron said to me, Jen, and been one of the reasons why prevention is so crucial. He he said he had a friend who lost his life in February before Aaron lost his life in October. And
Oh my
when
goodness.
Jake died in February, I said, Mom, I said, okay, Aaron, can we go after the drug dealer now? Because I was pretty naive about
Yeah.
drugs. I was really an alcoholic at heart. But and he said, well, Mom, there's always going to be another drug dealer. So the truth is, it's about the demand, and
Absolutely.
a substance being a solution. And I get that concept that a substance is a solution. And so what tools can we give these kids to help them feel safe, to ask the questions, to navigate towards other solutions than substances, and that it's dangerous, and despite the fact that what their friends are telling them that this Adderall is going to help you with your tests, well, what trusted adult can you find? And sometimes it's hard to find a trusted adult. So how can we get to them? All the different ways we can get to them, I think, is so important.
Well, I think you said a handful of really important things there. One of which is, Jake and then Aaron. I mean, if it's okay with you, I'd like to go back to the story about Aaron here in a minute, if you're comfortable talking more about that.
Sure.
But I think what we've really illustrated here is the profound lack of information folks have. Yourself, you just admitted not really understanding the drug situation, right? Even having had addiction issues yourself with the substance of alcohol. So, it is a demand thing, and it's a demand thing that addiction mandates is a demand thing, right? So as soon as you can get somebody, and who better than the young population who's striving to fit in, desperately wanting to belong somewhere, right? Is to say yes to that cute girl who offers the thing, or to the buddy that you wish would, let you be part of the team, or whatever the case. And it gets out of hand quickly because addiction is real, right?
Yes.
And a lot of times, not always, no blanket statements in any of these things, but in a lot of times, folks who are dealing are sometimes people who live in communities where there is no other economy.
Absolutely.
And it's the job to get, right? And it's lucrative, and it's sustainable.
Yep.
And it's not going anywhere.
Right.
So I think these are all really important points, including the need to give the kids an option to seek out information. I think there's one other thing that I was going to say. It's lost on me because I can't stop thinking about Aaron. Are you willing to share with us more, just sort of fill out that story and what that journey was like for you?
Sure. Yeah. Yep. And feel free to stop me if I'm going into too much detail. I have 3 children. They were all born after I found recovery. So, I had the naive belief that my recovery was going to keep my children safe from substance use disorder. And I talked to them about addiction as a genetic potential factor in their lives. And Aaron was the middle child, personality, big. I was talking with a friend about him this morning, and super talented athlete. And I always say, I don't know which came first, the developmentally appropriate experimentation or the orthopedic injuries, right? But at some point, I caught Aaron smoking pot, and we had big, humongous fights about that. And I found him with someone else's prescriptions, and I don't know what the prescription was, right? But I had the big lecture about we can't take other people's prescriptions. We don't know what they're going to do to us. Because I had no awareness, because I don't think any of us really did, that hydrocodone and heroin are the same drug in different chemical format, and how potentially super physically addictive opioid prescriptions are, right? And so in a short window of time, Aaron had this friend, Jake, who was concerned about Aaron and reported his concern about Aaron.
Oh, wow.
And then Aaron came to me in October of 2012 and said, Mom, I'm using heroin and I can't stop on my own. And I want to stop, but I can't. And I know recovery is possible because you and Dad have shown me that. And so and I think this is the other reason why I want the resources for parents, because in that moment, you don't really know where to go for treatment. You don't really know what the best solution is for your kid, and you're super scared about all of it. And it's super overwhelming. And at least I had some resources because I had, 12-step recovery I could fall back on and people. But if I have nothing like that, where do I go for information? So Aaron went to treatment. And I think treatment worked for Aaron for a period of time, but I also know that in 2012 we didn't understand opioid use disorder, at least in the Midwest.
Right.
And so we weren't treating it appropriately, and we weren't talking about naloxone. We weren't talking about how highly addictive it was and the potential for overdose should you return to use. And so Aaron, in probably August or September of the following year, started communicating that he needed help with his anxiety or he was going to go back to using. And I really think he already had started using, but his own shame and his own, I don't want to disappoint my mom, couldn't let him say that out loud. And, I tried to get him some help and just didn't happen fast enough. And he used again and lost his life to an overdose in 2013, October.
I'm so sorry for that. I am feeling in the center of my chest the several people that I've buried to overdose. Friends of mine who were in recovery, who were trying desperately to get this thing and use one more time.
Right.
And it's remarkable because we talked briefly about stigma. The stigma also becomes shame internally, right?
Yes.
When you're outside of it looking in, you've got an idea of who uses heroin, right? It's kind of like the cocaine and crack epidemic, right? Cocaine was okay, crack, we know who uses crack, right? And so all of a sudden that's worse than cocaine, right? Neither of which are really seen as, one of which is more seen as addiction than the other. And I think heroin and oxycodone and those types of things sort of bred that similar confusion, right?
100%.
And so when you're on the outside looking in, somebody using heroin, well, we know who that is, and we can dismiss them because they should do better than that.
Right.
One thing that you said to me that really struck me was he came to you and said, Mom, I'm going to use again if I can't find something to relieve my anxiety.
Mm-hmm.
And you suspected that perhaps he had already started using again.
Mm-hmm.
I've always said that people don't understand is that addiction for a while is substance use. And an individual uses substances.
Mm-hmm.
But once addiction takes hold, now the addiction is making the choices and using the individual. For example, think of addiction waking up in the morning and putting on the costume of the individual that you know.
Yeah.
And you mistake addiction for the person you recognize and wonder why they're behaving so badly. But there really is a necessary component of understanding that has to take place. And it sounds to me like you're working hard to bridge that gap.
Mm-hmm.
And we at Horizon are too, with the youth, with the parents, with the school administrators that don't understand these things.
Right.
For all of the Jakes and all of the Aarons, I'm just floored because there's so many that aren't named.
Right.
And go ahead. What were you going to say?
No, there's so many things into what you said, Jen, and the grief and loss is super hard and heavy. And, we've lost more people to drug overdose than we have in any of the wars that we've fought in our country. And there's a lot of people walking around carrying lots of grief.
Yes.
And lots of ambiguous loss for all those dreams that we had for our child that aren't going to be manifested. And then the surviving siblings sharing with me over the holiday break how they have survivor's guilt and just all the unintended consequences of this super treatable disease with the right tools, right? But one of the things you said that I think is important for listeners to understand when we talk about the stigma and the shame is that, because I had a dad say this to me once, well, my son died from pills, not heroin.
Yeah.
But but that doesn't make you better, your kid better, or any of it. And every time we separate ourselves in that way, we just feed the stigma and create the barriers that we've got to pull down to get people out, and into recovery. So I think that's super important as we're in this fentanyl poisoning, weapons of mass destruction narrative. We're still perpetuating the stigma when we talk in those terms.
Well, I appreciate that perspective. And when people are afraid, they're going to find any way that they can to other the situation that they're afraid of so that they don't have to relate themselves to it and do the hard work of understanding it. We see it all the time, the divisiveness in our society for multiple reasons, all of which are typically grounded in the fear of that thing, that person, the idea, the concept, and not wanting to be close to it, not wanting others to make the mistake that we might be close to it. So we other, right, folks? And I think heroin, what is overlooked often is the person using pills will frequently use the pills, sometimes starting with pain. You mentioned you weren't sure if it was the age appropriate developmental trying of something, or if it was the orthopedic pain from being a sports, being athletic, that caused the addiction or the substance use beginning. But I think what is often overlooked is even those of us who find pills through pain management prescribed by a doctor. Once addiction starts putting me on as a costume, it goes to multiple doctors and starts to get, where it can, more medication. And once that runs out and they're found out, the addiction is still stronger than ever. And ultimately they begin using heroin because it's the easiest thing to get. Right. And they're not having the choice anymore. Right. So that othering of someone using heroin, it's a matter of time, unfortunately.
My neighbor, she's in her 60s. She had a serious injury. She ended up on the street purchasing drugs off the street. It is absolutely true. And I understand the othering because of the fear. I understand all of that. And I really appreciate, Jen, your description of addiction, waking up and putting on the costume of the individual, because for people who don't have addiction, who aren't in recovery or otherwise, it's really hard to understand the illogical behavior and the harm that person that loves you, that you love, causes for you. It's super hard. It's a great description. Thank you for that.
Yeah, absolutely. So if you don't mind, I want to just speak briefly about, you've talked about all of the prevention work that you sort of have been doing for some time, and you've got a lot of courses that you offer. Thank you for bringing that up, and they're all listed on your website. I have a love and a passion for the resilience born of trauma survival and preventive factors and all of those things that can go into building resilience post-trauma events. And I noticed that one of your trainings is one of my favorite topics, not because it's a beautiful topic, but because I think it's really the foundation for all of humanity. If we wanted to stop othering each other, we could relate on this alone, and that's ACEs. Mm-hmm. Can you tell us about ACEs and just sort of explain what that is for our audience if they don't know, and also tell us about that course?
Sure. So ACEs are a term for adverse childhood experiences, right. And it is a 10-question tool.
It's a 10-question, survey that it does. Mm-hmm.
Yeah, to determine your level of adverse childhood experiences that can then indicate your level of trauma that you may have and some health consequences that have been shown through research to include substance use disorder with a certain number of ACEs. So we know if a child has 4 or more ACEs, they're a certain 3 times more likely to have substance use disorder later in life. I believe my statistic is right, sorry. But the point is that if we would use this tool, this simple tool, we could better understand people. And, one thing I heard once that I think is so helpful, Jen, to your point about othering people, is if we all walked around with a cartoon bubble above our head that showed our ACE score, wouldn't we treat each other differently?
You would hope.
You would hope.
We might start saying, I'm going to hang out with the 2s. Those 4s probably are headed to heroin. We'll find a reason, is all I'm saying.
That might be true, but I would hope those of us that have some compassion in our heart would be able to understand the other person that we're interacting with better, because we're really coming to the table in interactions and in conversations with those stories, with our ACE score, right? And so if we could better understand, we work with kids ages 9 to 12 affected by the substance use disorder of a family member. And we spend a whole lot of time on resiliency and protective factors and their ACE scores, because that helps you understand people. And it is definitely a predictor of health concerns and addiction later in life. So the course is just a basic ACEs and Trauma 101 to give you a baseline to help you understand this is something that you need to know when you're dealing with these populations of people.
Yeah, I really do. I think ACEs is one of the most powerful tools that's been created. I learned about it through Nadine Burke-Harris, who was at one point the Surgeon General of California. She did a TED talk about it, and I was it's like it put language to things that I've known my whole life that were true about myself and people that I knew that I didn't have words for before. I didn't have vocabulary. And it all started with some doctors in the obesity clinic who were recognizing that a large portion of their clients or patients, I suppose you say in that environment, patients who were coming in with obesity issues had a common thread of very traumatic childhood experiences. And they began to sort of look for trending, data on that, and they found it a lot. And so what they did is they started recognizing that maybe obesity was a result of or a coping mechanism for trauma, and they started to expand that research. And as you said, now we have very clear and identified evidence-based research that demonstrates the trajectory of somebody with these different levels of experiences that they've had, so that we can use it as a preventative measure, right? Yes. Not so that we can say, aha, you're going to have this problem when you're 20 because this happened to you, and just sort of put people in their bubbles, but rather to say, these are the kinds of things that you've experienced as adults and as educated providers and as, professional facilitators. Let's work with these young people to keep them from that trajectory to the best of our ability, right?
Yeah.
To the point of that, Kate and the Chatbot might be considered harm reduction.
Yes.
Which is also a favorite term. Frequently holds a tremendous amount of stigma and misunderstanding. Tell me your thoughts about harm reduction and where the Chatbot fits in that, but also where it fits in the landscape of this problem that we face.
Yeah, sure. So because I have been in abstinence-based recovery a super long time, when I first learned about harm reduction, which was actually before Aaron and before I knew I was going to do this work, and someone said to me, yeah, you can, it gives you permission to use drugs without harms or whatever. I was like, what? No, this is not a thing. We don't do this, right? And then subsequently, I've been better informed that harm reduction is this public health approach that we use all the time in many ways to reduce the unintended consequences of illegal or illegal behavior, right? So we always say, just because I wear a seatbelt doesn't give me permission to drive like an idiot. It just reduces the consequences should I have a crash.
Right.
Condoms, harm reduction, vaccinations, harm reduction, sunscreen, harm reduction. None of it's giving me permission to misbehave. And so harm reduction in the addiction space is meeting people where they are and helping them understand that there's a lot of paths to recovery and there's a continuum of harm reduction. So there's people who are still using drugs, just not chaotically, and that's considered harm reduction. And then there's abstinence, and maybe our goal is to get people all the way to abstinence, and that's not for me to say, right? That would be my goal, but that's not for me to say. But harm reduction is something that we have to consider. And when it goes back to the reason why we started Kate was to get you as a caregiver to have those conversations, or the young people to understand, just test your drugs. That's harm reduction. And if I test my drug with this simple little strip, just like a pH strip, and it shows that there's fentanyl, then I can choose a different approach. I can choose not to use, or I can choose to use less, or I can choose to call my friend and say, I'm going to use, and there's some fentanyl, so I might overdose. Can you be on call? Can you come over with the naloxone? All the tools to keep me alive. We need to keep people alive. And it's basic. It's not the solution to addiction, right? It's just keeping people alive to help them find their better self, as you talked about earlier.
Yeah, beautiful description. I also am in abstinence-based recovery. It's all that I ever knew in my own experience. But and I was very my nose turned away from things like needle exchange sites in the city, or like, why are we providing nice places for people to inject themselves with heroin or other drugs? Like, what is that about? If that's not enabling a drug addict, I don't know what is. Yeah. And then I got to talking to somebody in the city who worked in one of these sites, and what they explained to me was what I already knew to be true, that if you're addicted, you're going to use. Yeah. Right? The drug is already looks like me and is out in the streets doing what I have to do to get the drug, because my psychological self truly believes I will die if I don't. Yep. Truly believes that, right? So it's going to happen. And what we found is, without the safe sites, without the clean needles, one of the byproducts of the inevitable using with needles is that they were discarded on the streets. Yep. Some of the folks using who shared needles were carrying HIV or Hep C or all of these other things. So what ultimately we're doing in having these clean sites is not so much enabling somebody who's going to be using anyway, but trying to prevent the spread of HIV, trying to prevent the spread of Hep C, and the bottlenecking that begins to create in the healthcare system that's already overburdened. And so there's so many nuances to the things that, at first glance, we're pretty sure are bad ideas, that it's worth the investigation. Yeah. Right? Go ahead.
You might not be familiar, but in Indiana in 2015, we had one of the biggest HIV outbreaks that the country had seen since the AIDS epidemic in southern Indiana. And it was because of that very reason, that people were sharing needles. And there had been this outbreak of this specific drug that individuals were using called Opana. And it forced our very conservative governor to pass legislation to allow for safe syringe access. And at the same time was when we were passing Aaron's Law, which allows for naloxone over the counter. And so we had those sort of concurrent conversations about enabling. And yeah. That was really our argument was, you don't understand, someone's going to use whether they have naloxone or not. This idea that these young people are having naloxone parties where they're using and reversing overdoses is just not a thing. That's just not the logic behind people who are using, and they don't believe they're going to overdose in the first place, So It's not enabling. It's just keeping people alive, keeping people healthy, stopping the spread of communicable disease, which is super impactful on the economy, as you said, and to the healthcare system. And fingers crossed it doesn't happen again, because the legislation is up for renewal and it's not looking super promising. So that's a concern.
I'm sorry to hear that. And no, I wasn't aware of that outbreak. So thank you for sharing that.
Yeah.
So I think education is one of the greatest forms of harm reduction. And if people can at least wrap their heads around that, right, the more we know, the better choices we can make. Yes. So we're reducing harm by learning about the reality of situations, so that we have best choices to make. Now, you mentioned a few things that I'd like to talk about really quickly, and I realize that we're just about out of time. But you said something about, I made a note here. You said something about you're working with and correct me if I got this wrong, you're working with 9 to 12-year-olds to help them deal with family members who are experiencing addiction. Is that what you said?
Yes, we have a program. It's part of a national program called Camp Mariposa from the Aluna Network. And it's called a camp, but it's really a year-long mentoring.
Wow.
Right? So it's these kids have a family member or a loved one. We talk about addiction every time we're together, which is 6 times a year overnight. We write a letter to addiction in one form or another. So you don't have to write a letter, but you can draw a picture, or you can fill in the blank letter, like Mad Libs, if you remember Mad Libs.
For sure. Oh, yeah.
But any way that you can communicate to addiction how it has affected you and how your life is going to be better without it. We teach the kids they didn't cause it, they can't cure it, they can't control it. And then we give them the tools to communicate their feelings and to take care of themselves. It's a beautiful thing. And I think, Jen, this is the way we maybe stop this intergenerational trauma we talked about earlier with the ACEs, because no one came to me as an adult child, I'm an adult child, and told me any of these things. That's super normalized. All of the stuff in those family systems is super normalized. So it's my hope. It's a beautiful thing.
Yeah. So for the audience, adult child just means somebody who is now an adult that grew up in a family system that was marked by addiction. I think you can also probably expand that to mental health or incarceration, the types of things that have created really dysfunctional family systems that a child had to sort of learn to navigate. Once you grow up, you've got all of these sort of broken ways of navigating the world that cause a lot of problems when you're an adult, but became habits from you depending on them as a child. So that's what we mean when we say an adult child. So I appreciate you bringing that up, and I'd love to see us break the intergenerational trauma. But I mean, like anything else, I think the desire to learn about stuff like this that fits in the other category most of the time is a relationship to the thing, right? So unfortunately, a lot of times we have to experience something horrific, whether it be become addicted, watch somebody that we love become addicted, or lose somebody to addiction, right? Before we really invest in understanding what it is. If I'm not mistaken, about 90% of addictions have been proven to originate during the teenage years. That's actually from your website on Overdose Lifeline.org. And that's a high percentage.
Yeah.
That's worth taking a look at. That's worth investing in prevention programs. That's worth investing in helping the youth deal with the trauma of growing up in or losing a parent to. That's worth the investment. So I'm grateful to you for that. A question about the Shorty Awards, if you could explain what those are and how you got involved in winning in that. And also, I have one question to lead us out.
Great. Yes. So the Shorty Awards are awards that are given to And I'm super naive about it, Jen. Actually, we work with a creative team. Their name is actually Good Creative, and they're the ones who helped us with some of our promotional materials around launching Kate, and they're really the impetus behind building the platform. And so the Shorty Awards go to marketing and communication and public relations type messaging. And it's super thrilling to be acknowledged for something cutting edge using technology for a stigmatized topic, right? That some of the things that were recognized there are things that we're really happy to talk about, but people still, as you've said so beautifully in this conversation, other addiction. And so I hope that what it does is it gives it some legitimacy and has people take a look and want to learn more about Kate and how they can use it.
I appreciate that. Well, it's certainly put it on our radar in looking for guests to talk about. We'd like to talk about things that are happening technologically. I mentioned this at the beginning, and also forward-thinking folks, solution-oriented folks. And I saw that you've been around for some time and that you've done an incredible job of developing materials and trainings and resources. And you're just involved in so many different areas that I'm really glad that you were given that award so that more people can learn about you, because I'm thrilled to tell folks about you. My outgoing question would just be going back to Kate, the chatbot. Right now, it sounds like it is specifically designed to sort of answer the questions about naloxone and fentanyl and opiates and these types of things. My question would be, do you get a lot of questions outside of those parameters? And where do you see this tool? What do you see it growing into in the future, if anything?
So we've built Kate to answer the most commonly sourced materials that people are looking for as it relates to harm reduction and addiction and substance use disorder
In general.
But we also want her to be a resource for local use if needed, right? So we can build her for others. We can change her language to be local resources. And we're also working to help her speak to those other populations, as I mentioned, more specifically the young people.
I missed that last piece. And you're also working to have her something about young people,
so that she can, to build her so that she can speak to those other ages, specifically the young people.
And how do the young people find out about this? The audiences that you're serving, how are people locally finding out about your service?
Sorry, I missed it. What did you say, Jen?
How are folks locally? How are the youth? How are the parents? How is the community locally finding out about your program or this opportunity with the bot?
Right. So we do a significant amount of social media. We did some paid ads when we launched her last March. We did some billboards. We'll do that again this next round when we launch it for the youth, and we're working with some local colleges and universities to get the word out that way too. We're going to put some posters up in some bars and some nightclubs because we want to reach those audiences also.
Very smart. Good. Wonderful. Great work. My goodness. As somebody who's been doing design and marketing and addiction teaching and treatment and all of these things, I love everything that you just said. Brilliant. Old school billboards and posters and the social media and all the stuff. You said that you had the kids in Camp Mariposa right to addiction, and I taught in the jails for many years, and I taught about addiction and recovery, and that was one of my assignments, and some of those letters were heartbreaking.
Very.
And remarkable and revealing. So unless there's anything else you think that we haven't talked about that you think is important to add, is there anything you'd like to add before we go?
No, I think, if you want to find us, you've already mentioned the website's super simple, overdoselifeline.org. I'm happy to help, happy to have conversations about how we can all do better, because that's really the goal, is to, fill the gaps and do better.
Absolutely.
Thank
Thank
Jen.
you for your heart. Thank you for your commitment. I'm going to say thank you to Aaron, because in a horrific way, Aaron is starting to take care of a lot of people. Thank you, Aaron.
Thank you.
Thank you for your time.
Thank you.
All right. Please visit our website to learn more and to connect with us on social media. Our website is www.horizonservices.org.
Horizon Treatment Services, inspiring hope and healing since 1976.